afternoon and good evening. 1,221 days ago, WHO learned of a cluster of cases of pneumonia of unknown cause in Wuhan, China. On the 30th January 2020, on the advice of an emergency committee convened under the international health regulations, I declared a public health emergency of international concern over the global outbreak of COVID-19, the highest level of alarm under international law. At that time, outside China, there were fewer than 100 reported cases and no reported deaths. In 3 years since then, COVID-19 has turned our world upside down. Almost 7 million deaths have been reported to WHO, but we know the toll is several times higher, at least 20 million. Health systems have been severely disrupted, with millions of people missing out on essential health services, including life-saving vaccinations for children. But COVID-19 has been so much more than a health crisis. It has caused severe economic upheaval, erasing trillions from GDP, disrupting travel and trade, shattering businesses, and plunging millions into poverty. It has caused severe social upheaval, with borders closed, movement restricted, schools shut, and millions of people experiencing loneliness, isolation, anxiety, and depression. COVID-19 has exposed and exacerbated political fault lines within and between nations. It has eroded trust between people, governments, and institutions, fueled by a torrent of mis- and disinformation. And it has laid bare the searing inequalities of our world, with the poorest and most vulnerable communities the hardest hit, and the last to receive access to vaccines and other tools. For more than a year, the pandemic has been on a downward trend, with population immunity increasing from vaccination and infection, mortality decreasing, and the pressure on health systems easing. This trend has allowed most countries to return to life as we knew it before COVID-19. For the past year, the Emergency Committee and WHO have been analyzing the data carefully and considering when the time would be right to lower the level of alarm. Yesterday, the Emergency Committee met for the 15th time and recommended to me that I declare an end to the public health emergency of international concern. I have accepted that advice. It's therefore with great hope that I declare COVID-19 over as a global health emergency.